Sapna, good morning.
Good morning.
Welcome back. Thank you for coming back in.
Thank you.
You look, you look very well put together. So, how are you feeling today?
I'm okay. I'm not okay. I don't know. I'm like really confused.
Okay, do you want to go into that a bit further?
I don't know. It's my whole week was like really overwhelming since we met last. It's like I'm all over the place. I don't know where I'm going, where my life is going. The school is like really stressing me out. I don't know, like I don't feel like working and then I don't remember anything. Like I know this moment I have to do this work. I'll reach home and forget and then I have to go all through my notes again and again because I don't recall. It's like it's really overwhelming. It's really pissing.
So, from what I'm hearing, is that you're back in school now. We've talked a bit about that, but you're finding it extremely overwhelming because you feel like you're not retaining a lot of the information.
Yeah, you can say like, I don't know. I just don't know. I don't feel like I'm present there. I don't know. Like, I don't remember anything anymore. I feel like, I'm so dull.
Okay, and how is that making you feel?
It is really like frustrating me. It's like making me really irritated and stressed. Like, and even I don't feel like doing anything anymore. Like, I just feel like I should like leave everything and just go.
Okay, okay. So what I'm hearing from you is you're having some issues with retaining or remembering and kind of learning some of the new material that your teachers or professors are going through
Yeah,
in class.
actually, you can say that because like my attention is not there.
Okay. I'd kind of like to go a bit on a scientific side for a moment.
Mhm.
Can I ask you, just from our past previous sessions and kind of what you've been willing to share with me, and again, I thank you for that. That's never easy to share or to re-experience by telling another person. But what I'm kind of hearing from you is a bit sounding like what it's a very normal response
Mhm.
to the type of experiences you've had. So I don't want you to feel abnormal or anything.
Is
It's
it?
it's common with someone with your history. So how much do you know about the and I'm going to use some big words. Stop me to explain anything that you want. But
Okay.
how much do you know about like the neurobiology or the structures in our brain and how it's affected by trauma in our past?
Oh, I have no clue.
None?
I have no clue yet.
Okay. So I'm going to use some analogies.
Okay.
If at any point something's sticking out that's not quite there for you, please stop me and we'll kind of go through it.
Okay.
Okay, so there's been a lot of research recently with being able to image the brain with MRIs and everything else, a bit about the changes that go on in both in the structure and how everything's wired together um, after experiencing and surviving various traumatic events. And everyone is affected slightly differently, but then there are also some very common symptoms. And that's what I'm hearing a bit from you. So, what I'd like to explain a bit is a bit about that neurobiology. So stick with me here. There's many parts to the brain.
Mhm.
Okay, there's three major parts that they like to talk about, which is our reptilian brain, our mammalian brain, and our human brain.
Okay.
The first two make up our limbic system, our emotional system. It's kind of our fight and flight response. The human brain kind of makes up all that. Um, don't want to say intelligence and knock all the other animals out there not being intelligent, but our human intelligence, our rationale, our problem solving, our complex thinking, and our abstract thinking all comes from that prefrontal cortex. So it's very important to how everything functions. So we've got that emotional brain,
Mhm.
which is those first two parts, and we've got our um, rational brain. Now, in the emotional brain, there are certain structures that are very involved with stress response and can be very affected and sometimes actually change in their physical structure due to experience with traumatic events and surviving those traumatic events. With the memory loss or the ability or the feeling of losing the ability to learn, to problem solve, to gain new memories, to restructure things into new memories. A bit from what I'm hearing to you has a lot to do with the hippocampus.
Okay.
So I'm going to put a few structures up here, and then I'm going to kind of go through it. So that rational brain is mostly just right there. These guys have a lot to do with there. So all that stress response that we get when we experience repeated or just extreme trauma activates this.
Okay.
This is like a smoke alarm. It's more, yes, it's like a smoke alarm, and it's kind of one of the bosses in our brain. And it sends signals down to the thalamus, which communicates with various other parts. The hippocampus here is actually involved with our memory, learning, and problem solving, which is what I'm hearing a lot from you. When the amygdala becomes overactive, which can be seen with repeated trauma, extreme traumatic events, and going further, re-experiencing those events, the more this goes off, the smaller this gets. And if we look at that first word, hippo, you think that the hippocampus should be a sizable structure. It is rather small, but as it gets smaller and smaller, we lose the ability to really engage some of this stuff. And the more of a feedback loop we get here with the overwhelmness, the stress, post-traumatic events, the more this gets a feedback loop going, and this kind of gets cut off, which we know is our rational brain. So we want to kind of re-engage that and kind of break this cycle that's going on. One of the really nice things about this is the brain changes due to traumatic events. Doesn't mean it has to stay that way. They aren't permanent changes. How are we doing so far with the information? Are you following?
Oh, yeah, it helps me a lot. Like, now I understand what's happening so far.
Any questions so far?
No, I'm very much clear. Thank you.
Okay, so from what we know about your past and from what you explain about the overwhelming feelings being constant, it sounds a lot like there's a feedback loop going.
Yeah, I can see that.
This guy's been cut out of the mix, okay?
Yeah.
Because this guy's job is to kind of patch in everywhere and to communicate here and to communicate back here. But he's stuck in this cycle. And we want to bring our rational brain back in and kind of rewire the circuitry to expand that circuitry again to a healthy position. And over time, we could see growth back in the hippocampus and a bit of deactivation within the amygdala. So, are we good so far?
Yeah, very much.
I'm actually wanting to kind of introduce you to a couple grounding techniques. So when you feel that overwhelming feeling and it feels like this is getting set off again and you're just in that stress response, taking a step back and grounding yourself and trying to get this re-engaged a bit. And over time, it's not an overnight process. It does take a lot of time. We can break that circuitry and hopefully see that growth and that activity back in the hippocampus, which will help here.
Okay.
So do you know what I mean by grounding techniques?
I don't know, like, I'm not sure. Can you, like, tell me?
Certainly. So in a lot of situations with trauma survivors, and we're stuck in the circuitry, we spend a lot of time outside of the present moment. There's a lot with flashbacks, reliving, triggers, different sensory inputs that trigger those emotions from those events, and we're no longer in the present moment.
Yeah, you can see that in my situation. I do have like some dreams lately, like which is just bringing me back to the same schedule, like things.
So, what I'd like to do is maybe practice two grounding techniques. One, really simple. I personally like to do it kind of before bed. And one is a little more complex, not too complex, but re-engages this a bit. So the first one is very simple. It's placing a hand on your chest and on your stomach. Now, when we're in a stress response, our breath tends to stay in our chest because it's up high. When we're in a bit more of a rest and relaxed state and sleeping, our breath tends to be in the stomach. So a really simple grounding technique is focusing on the breath, but not getting caught up exactly what's inside, but by just observing your hands and noticing which one moves more. And if we notice that the upper hand is moving out and in more, to try and bring that breath back into our belly by engaging our diaphragm and those muscles. Really simple. Now, I do know a lot of people don't like to focus on breath. So another really good one is kind of bringing things back to our senses. Because when we experience our senses, it's most of the time in real time. So it can be complex as counting down from 5 with our senses. There's 5 senses. Or simply one from each sense. So what I mean by that is you've got your 5 senses, your taste, smell, touch, hearing, and seeing. And just going through the list of those 5 senses and naming one thing that you can experience with that sense. So if I were to do it, it would be I can see the table, I can feel the wood, I can smell the aroma from down the hall, and I can taste the coffee that I recently have had, and I can hear actually the traffic from the 401. A way to take that one step further is to kind of add one aspect of that thing. So right now I can see the table, it's brown. I can feel the table, it's hard. And notice that I'm not using evaluations. Whether the table's good or bad is beyond the point. It's just a table and it's hard. Simple observation. So, do you feel comfortable with that?
Yeah, actually, I can
Okay.
do that.
Do you want to go through one with me, real simple, just one from each sense?
Oh yeah, I don't mind that.
Yep.
Yeah.
Okay, so in your own time, when you feel comfortable.
Yeah, so I can see you right now, and yeah, again, there's a table. Yeah, there's a fragrance, like a flowery fragrance in the room, and I can, I do hear the traffic. That's all.
Taste?
Oh, so I don't really have any taste right now, but then yeah, it's like neutral in my mind.
And the taste is a very, very strong one as well. And actually, so is our sense of smell. So, a good example that I know from previous clients, one client had always carried around hard candies in his pocket for taste. And he specifically chose maple so that it would remind him that he was on Canadian soil. His traumatic events had to do with being outside of the country. So that taste of maple really brought him back to where he was presently. It was very tied to our memory. There's a lot of literature out there that states that our sense of smell is very tied to our memory. So a smell from your childhood or anything like that, if you can think of maybe your mom's old perfume or your grandmother's old perfume, something like that to carry in your pocket to be a quick reminder of that smell. So you can definitely stage things in your pocket, carry things around that are for touch, for smelling, for taste, to be able to engage those senses as well. But we can always hear things, we can always see things, and we can at least engage those too. And using those aspects of what we see and what we hear to further our engagement and our involvement with the present moment.
Okay.
So the table, it's brown, it feels hard, it's cold to the touch, but it warms up under my hand. I've really engaged and come into that moment and experienced the table as much as I can take a table. So how does that sit with you? Does that kind of make sense?
Yeah, that makes a lot of sense.
Okay, do we have any questions regarding this or
Uh,
the neurobiology?
no,
It's
that's
kind of a
very
lot of
clear.
information.
Mhm.
and I'll definitely go through it again next week.
Okay, thank you. Yeah.
We'll kind of revisit this a few times, and as we go on, we might notice some symptoms going on that has a lot more to do with the amygdala, or it has a lot more to do with the thalamus, or has a lot more to do with the cutoff of the frontal cortex. And we can go a bit more into the involvement of what each of these did, because I really just explained the one aspect today. So if you feel comfortable with going forward with those for the week, try to practice some of those grounding skills, especially when you're feeling overwhelmed in school, and take that one step further to re-engage that a bit into the present moment and see if that works along the lines of just a fraction better in being a bit more attentive at school with the learning and the memory. And we'll go from there next week. Does that sound all right?
Yeah, that sounds all right. I can do that for a week and try it because I'm really tired not remembering things, so I can really try that.
And you're sure you've got no questions? You wouldn't imagine some of the questions I do get from this.
Yeah, but you explained it very nicely. It's very much clear in my mind.
Thank you very much. All right. Well, thank you again for coming in, and I'll see you next week.
See you next week.
Thank you, Sapna.